It was a cold winter night, and I remember coming across an article that was describing an unusual cluster of a new viral infection out of China. Seemed like something that wasn't getting enough traction initially, but in a mere few days, there were 41 cases being reported, a handful of people with severe illness, and in fact, human-to-human transmission. Suddenly, my disease detective antennas perked up. I knew immediately that this was something serious. As the hours and the days passed, there were scattered reports surfacing out of the Far East about this mysterious illness. Very quickly, we learned that this dreaded fear of ours was in fact a reality. The virus was being transmitted from people who had no symptoms at all. From a containment and public health perspective, this was the worst case scenario. I had this sinking feeling in the pit of my stomach that what we were seeing now was just the tip of the iceberg. I remember ringing the alarm at my facility and speaking to so many of my colleagues in healthcare. Ironically, they didn't share the same concerns or fears that I had. Even when the cases were surging and Wuhan went into lockdown, the fact that this was happening thousands of miles, oceans and continents away, made it an unlikely reality. Even as the virus was consuming Europe, the fact that this was not happening in our backyards, people still felt invincible. I remember preparing my health system for what was on the horizon, and slowly we started hearing about the cases in our nation. We found ourselves watching on through the windows as the tsunami tidal wave of COVID was about to arrive. I found myself burning the candle at both ends over the next several months. From the pandemic preparation I had started in January and implemented over the next 6 weeks, we finally started seeing our cases and then our surge. Patients started trickling in slowly at first, not even knowing that they had the virus. They were incidentally found to have it. And then came the real symptomatic ones. Despite reading for long hours through the night, studying what was happening globally, what arrived at our doorstep was quite different from what all the experts were saying. From all the knowledge that I had gained internationally to what I was seeing personally was quite jarring. All along, the story had been that it was going to be that elderly person with underlying medical conditions whose immune system was suppressed, who was going to be so sick that they would in fact require hospitalization. Meanwhile, my first patient, I will never forget, was a 20-year-old healthy male with no medical history who was so sick and gasping for air that he described it as a feeling of drowning. And he had that look in his eyes, that look that I will never forget, that look of fear, that look that so many of my patients would have, not knowing if they would be the lucky ones to survive this. As the pandemic soared on and New York was the hardest hit, Mother Nature and the tsunami of COVID was relentless. Day in and day out, I would get up every morning thinking, maybe this was just a bad dream. Maybe today, life before COVID would resurface. However, no such luck. I found myself working 7 days a week, 12 to 14 hours a day, reading all through the night, trying to keep up with all the preprints, a record 50,000 publications or more, writing and revising policy as the national and global guidelines were changing. We were learning about this virus on a practical hourly basis. My leadership and humanitarian instincts kicked in. As a physician, but moreover as a human being, I needed to do more to save more. How else could I do my part? I was lucky enough to have a supportive husband and children who were my anchors in all of this, but I was certainly feeling the strain. I was juggling to keep up with it all, between policy planning, taking care of patients, running clinical trials, research, disseminating information to the public, social media. I found myself running on empty. I had so many ideas, so many things that I wanted to publish, but the lack of support from the workforce really inhibited me. I was juggling not only my work and my family, but I was juggling childcare and elder care. As we went into lockdown, my parents, like so many senior citizens, became isolated and withdrawn. My children were juggling to adjust to their new normal. So many women across all industries were feeling the strain. Women who have their usual jobs, which are very demanding, were now adding on even more responsibilities, whether that be being present for their children's needs, whether it may be childcare, school, elder care, being available for other family members. So many women in industries were feeling the strain. Sheltering in place meant that all the resources that women once had available to them were no longer available. Moms across the countries were now adding on more roles and responsibilities on top of already being multitasking household members. The strong strain on women sent ripples across the female workforce. Very quickly, we headed into a she-cession. Women were declining in their careers and industries at a faster pace than ever before. And when a global pandemic hit, who was left to pick up all the pieces? Women. In science and in medicine firsthand, we saw a record number of publications arising in a short time span of this pandemic. Surprisingly, we also saw how few women were authoring these works, even though women were working very much on the front lines in every aspect during this pandemic. Women were suffering serious declines in their advancement of their careers. Due to this shifting narrative, women were unable to take advantage of timely opportunities. It's been reported that despite over 660,000 jobs being added to the workforce just between August and September, over 865,000 women have left the workforce altogether, as compared to just 216,000 men. 1 in 4 women has considered downsizing their careers or leaving the workforce altogether. When this data is looked at even more closely, we can see that the inequities that are present in the pandemic really translate into the female workforce. Women's progress in workforce, which has taken decades to build up, was disintegrated in a mere few weeks. Even though more women are graduating college than men, we can see that all the inequities that had been present over the years have just come to light and the forefront during this pandemic. Women and women of color are often disadvantaged from the workforce. Women of color do heavy lifting in academic institutions, but they are seldomly found to be in leadership positions. Or if they are lifted up, oftentimes the power from their roles is diminished, leaving them really with these empty titles. With all of the women out of the workforce or struggling to stay in the workforce, men can be strong allies for women and help support them and promote women across all industries. Men and other women can see a woman who's working hard, and when it comes time, they can promote them, they can publish them, they can mentor them, they can sponsor them. If this pandemic has taught us anything at all, it has certainly taught us where our strengths are and where our weaknesses are. During my grueling 14-hour days, taking care of patients, leading the multidisciplinary task force, I found solace in my strong support system. Whether it was my husband or my children who were my anchors in all of this, or the strong community who stood beside me through it all. From delivering PPE to my hospitals, or delivering meals to my home for my family and I, so that I didn't have to think about what I was going to make for dinner in that small little bit of time that I had in my day. It was the community that put signs on their lawns that gave me strength as I drove past my neighbor's house every morning heading into battle. Their support and encouragement gave me the strength to power on, despite the fear, despite the anxiety, despite the sorrow of the lives lost. It's this kind of public-private partnership that we saw on a small and large scale during the pandemic that can really help women thrive. If more women had access to childcare, to elder care, to home responsibilities, whether it be grocery shopping or meal planning, more women would continue to stay in their careers and their work that they have worked so hard for over the years. If men and other women see the struggles of a woman and provide a solution, even the slightest lend of a hand, by providing peer mentorship or sponsorship, we would be seeing more women thriving in their careers right now. We need to invest in the infrastructure now to to protect the future generations of women in the workforce. The impact and the damage of this pandemic will take a very long time to undo. In the meantime, it's more than likely that another pandemic will be upon us. With the ongoing globalization of travel, urbanization of land, and climate change, pandemics will be occurring more and more frequently. Whether these occur from a novel virus which jumps from animals to humans, which we've seen over the years, or from a strain of a highly resistant bacteria, superbugs, that we've been dealing with in our country and our globe, these resistant bacteria have led to 35,000 deaths yearly and over 3 million people being affected in the United States alone. We are running out of treatments for these resistant bacteria, and without a pipeline of novel drugs being researched and developed, it's very likely that the next pandemic that will be upon us will be one from this extremely resistant bacteria for which we have no cure. How can we prepare ourselves better for these? We need to invest in building that infrastructure now. We need to provide access to healthcare for people who are most vulnerable, who are most affected. We need to provide care for chronic conditions for people who are not only affected by COVID-19, but by infections from these resistant bacteria. We need proper science-based messaging about vaccinations. Vaccinations save lives. Vaccinations have been proven to be safe and effective. Vaccinations have led to the eradication of so many infectious diseases globally and nationally, diseases such as polio, smallpox, diphtheria, to name a few. With all the emerging misinformation spreading like wildfire, we need proper messaging about life-saving vaccinations so that we can prevent future pandemics, including one caused by a resistant bacteria. So as I look back at that 20-year-old patient of mine who was sick enough to be hospitalized, but lucky enough to survive this, and I think about that 40-year-old patient of mine who was unfortunate enough to be placed on the ventilator and unlucky enough to not survive this. And I think about that 70-year-old patient of mine who was so sick and in so much agony that her family just wanted her to be comfortable. I think about how we were all affected by this pandemic. Every person who contracted the virus has had a battle with the virus. As healthcare workers, we've been out on the field fighting with everything in our armamentarium against this virus. With each passing day and science on our side, we learned about more data-driven life-supporting measures, and we started saving more lives than losing them. We still ache and mourn for all the lives that we lost, but we celebrate the ones that we save. We often live our lives in silos, not realizing that we in fact are living in a world that's stacked up like dominoes. We seldom realize that a person elsewhere or an event elsewhere can have a direct impact on our existence. If we start thinking globally and not locally, we will be better equipped to deal with the struggles which may impact us at any point of our history. Thank you.